Amen. We have heard that the great physician is here and is going to heal you of whatever affliction you have come with today in the name of Jesus Christ. Today is our eighth Sunday. We thank God for blessing us with some health professionals in our midst. And over the years, we have not been spending money bringing somebody from outside to come and speak to us. God has blessed us with Dr. Bamigboye and a few others that have been using to speak to us. And this year too, God is going to use him to speak to us on the issue the convention asks us to treat this year. But I want us to open our hearts. If you have to write some things down and you need to have a question you want to ask, don't wait till the end. As the question comes to your mind, write it down. Because we are going to give opportunity for question and answer. Your head is important too. Out of whatever you are chasing around, chase your head first. It's a foolish man that chases everything and abandons his head. This body is very, very important. More important than any other thing you want in this world. So the Lord will help us as we open for learning so that we can receive specific instruction that will help us to manage our head, manage our body right. Some people do things that they use their hand to destroy their head ignorantly. So as the Lord speaks to us this morning, I pray that we shall be enriched in knowledge in the name of Jesus Christ. You are welcome.
Praise the Lord. We want to once again welcome everybody to this year's Health Week. And first of all, I want to thank the church for giving us the opportunity to come again and mark the Health Sunday. This shows that you understand the place of health in the church. Okay, because if you have good health, definitely the church will grow. And if we have any one of us who is sick or who is suffering from one form of disease or the other, definitely the ability to be able to flow with the spiritual movement within the church will be affected. So our health is very important, and we thank the church for giving us the opportunity to be able to mark the Health Sunday. Media, can you just project the slide so that we can follow? This year, if we go by the topic that is given to us by the convention, we'll be talking about the liver. That's the topic we are asked to talk about. Last year, I think we talked about diabetes mellitus. That is our topic for last year. But this year, we'll be moving further to talk about the liver. And before we go, we want to understand what the liver is all about. And so I understand most of us who've had liver. Actually, when you go to the market and you want to buy meat, you say, Ejo, I need the liver. We call it Edo in Yoruba, Edo. Okay? The liver is very, very important. The vital organ in our body. A very, very important organ in our body, such that we can't live without it. There are some organs in the body, like the kidney. If you have one kidney, okay, you can really survive and live as many years as possible. Not like the liver, because virtually all activities in the body is taken care of by the liver. So the liver is very, very important, and that is why this talk is germane for us to be able to understand what the liver is all about, the role it plays in our body, and how we can live a life that will keep our liver and overall our well-being safe. Okay? Now, this is just introduction. I think it's part of what Pastor have mentioned, that our body is very important, and we should know that our body is a temple of the Lord, and we need to keep it as healthy as possible so that God himself can tabernacle with us. Okay, today we'll learn about the liver, okay, which I've explained as one of the most important organs in the body. Let me just talk about a brief medicine, okay, because this is more of health talk. At the end of the service, we'll go to the spiritual part of our health, but the liver, okay, is the largest organ in the body. It's the largest organ in the body. We have other organs like the heart, you have the brain, you have the kidney, you have the ovary, but the liver is the largest of all. Okay, and as we all know, it measures about 1.3 kg. So if you measure your weight, let's say you measure your weight now, okay, 1.3 kilogram of your weight belongs to the liver. That shows how important the liver is. And as I mentioned earlier, it has a lot of functions in the body. Its function is numerous, over 500 functions in the body. So you can imagine what that means. If a single organ is carrying out over 500 functions in the body, it means it's very, very important. And our day-to-day activities, the food we eat, the water we drink, is actually, in one way or the other, handled by the liver. So which means if you have anything that affects the liver, it's going to affect even our food and whatever we eat. Okay. It is essential for life, and we cannot live without it. It's one of the organs that, if it's actually diseased or is affected, the tendency of survival is slim. Okay, actually, if it's not picked on time. Okay, so it's that important for us. Okay, the next slide. Now, where does the liver locate? Is located. Where is it located in our body? Now, it's an internal organ. You cannot see it. Hello? Okay. It's an internal organ. It's located within our tummy. That's the abdomen. And to be precise, it's located here, around, just below the ribs, just underneath the ribs. That's where it's located. Normally, you cannot feel the liver. Probably if you go to the hospital and they are checking your tummy, normally you should not be able to feel the liver. Which means if you try to examine, you cannot feel it. It's very large, but because it's hidden under the ribs, and that is one of the peculiarity of the liver, it's hidden somewhere where it is well protected, such that if there's an injury, there's an accident or something, impact is protected. Nothing gets to it. That's how vital it is. So it's located underneath the ribs and is well protected. In a situation where you can feel the liver during examination, when they are checking you, okay, that's what we call examination. When they are checking the hospital and you can feel the liver, it means there's a problem. A liver should not be felt. By the time they start to, okay, I can feel your liver is big, then there's a problem. Then one begin to look forward to identify what is the cause and begin to manage it as soon as possible. Okay, what are the main functions of the liver? As I said, the liver has over 500 functions. The functions are numerous. There are some you cannot even identify. But the key ones that I think are very important, that once it's affected, it affects our whole well-being, are the ones we mentioned. One, it cleans the blood from toxins and drugs. What does that mean? Most of the drugs that we take, most of the drugs we take, paracetamol, or you say paracetamol, you take ibuprofen, you take a lot of drugs. After the drug, some of these drugs are not in their active form. Okay? They are not in their active form, which is once you take it that way, they won't do anything until when they get to the liver. The liver now converts it into something that is very, very active. That's when it can actually serve the function. So which means if there's a liver issue, if you take certain medications, you're not doing yourself any good because the drugs will not be changed into the active form. So it needs to be converted first to the active form before it can perform its function. Aside that, even if you take some of these drugs, and there are some drugs that when you take them, they're already in their active form, but after they've performed their function, they need to be cleared away from the body. It's actually the liver that does that. So it converts some of these drugs in the inactive form to the active form, and those ones that are already active, after they've carried out their function, they become a problem to the body. They become toxins in the body. And the function of the liver is to clear those toxins from the body so that there's minimal side effects from those drugs. So if you take certain medications and the effects is over, the function is over, the metabolites, that's the remnants of the drug in the system, is rapidly cleared off from the liver, so that the drug no longer becomes a toxin or a problem to the body. Okay, it also helps digest food and takes fat by making bile. So when we eat, there are certain things in the food that is absorbed. Okay, actually, for example, if you eat rice now, okay, it gets to the stomach, it is digested in the stomach. Okay, not all the nutrients that you absorb from the food you eat is used by the body immediately. Some need to be stored. Okay, and that's the function of the liver. The liver helps to store those excess nutrients in the body and keep it during the time when you may not have access to food. So that's why actually when we are fasting, some people can actually fast for days. It's because the food you have eaten, the excesses are stored in the liver, and when there is a need, the stored food is broken down to serve as energy to keep the body going. So the liver serves that function. Okay, produces proteins needed for blood clotting. Now, when you have a cut, you have a wound, after a few minutes, you see clot formation. The wound is sealed up by a clot. Okay, there are some things that are produced in the body. We call them proteins or clotting factors. They are produced in the body that help with clot formation. If we have a diseased liver and the liver is not producing enough of those proteins, when there is a cut or there is a wound, the person continues to bleed. Okay, so in people who have liver problems, liver issues, usually they have problem with bleeding. So you don't even want them to have any form of wound or injury, because some of these proteins, some of these factors that help in clotting are reduced in them. That's a very important function of the liver. Then also helps to fight infections. There are some proteins, some antibodies that are released from the liver that helps to fight infection. So it's not all the time. Most of the time, we are exposed to infection. The food we eat, the water we drink, the air we breathe in. Okay, those things contains a lot of germs, bacteria, virus, and all those things. But our body has a defense mechanism that helps to fight them. And some of those defense mechanisms are produced by the liver. So if there's an issue with the liver, the body is prone to infection. So any small infection, any small malaria, any small bacterial infection or virus can actually and the person has issues with the liver, can become a major disease, something that in the instance, it can actually be managed without any problem. So the liver also helps to fight infections. Okay, the liver processes what we eat and drink. This is also very important, especially when we eat a food that is rich in fat. Food that is rich in fat. When we eat fatty food, okay, the liver produces some things that help. We call it bile. It helps us to absorb fat easily from the body and get stored. So in a situation where there is reduced liver function, the liver is not optimal, most of the fatty foods we eat will not be digested easily, and we can easily pass it out in stool. Okay? The liver processes what we eat and drink, as I've mentioned that earlier. The nutrients in energy and stores what the body needs. So if you take excesses, okay, if you eat and the body absorbs the food you eat, the excesses are stored in the body for the time when there will be a need to use them. Okay, next slide, please. Now, I've talked about the functions of the liver, but there are two main factors which I really want to emphasize on that are main problems to the liver. There are a lot of them, but two factors are major cause of liver disease. One is alcohol, and the second one is hepatitis B infection. Those are the two major factors that actually cause a liver problem. I'll start with alcohol. Alcohol is a major cause of liver damage. I know there are news that goes around that take alcohol is safe, it helps to burn the heart, it helps to keep the heart strong, make us strong and healthy. But I'm sorry to tell you that there's no amount of alcohol that is safe for the body. No amount of alcohol is safe for the body. Because when you take alcohol, it's converted to certain toxins, okay, metabolites, which can actually damage the liver. So use of alcohol is a major risk factor for liver injury, okay. So regular drinking can cause swelling, scarring, and cirrhosis. So what happens is, by the time these metabolites are released from the liver, actually it's the liver that actually helps to metabolize the alcohol that we take. But it produces some metabolites, which is called methanol, and it's very, very dangerous to the liver. So when you are exposing yourself to alcohol all the time, the alcohol gets to the liver changes this alcohol into something that needs to be excreted, but it keeps on is being exposed to this toxin. With time, it begins to affect the liver cells. Liver cells begin to get tired, they begin to swell up, and may actually cause potential liver damage. And as Christians, we're encouraged to avoid harmful habits. This passage talks about the impact of alcohol on the body. Okay, what are the common liver problems? Is hepatitis. Hepatitis is inflammation of the liver. You know, earlier I mentioned that two major factors are responsible are the common causes of liver injury. One is alcohol, which is not safe. There's no amount of alcohol that is safe. Then the other one is hepatitis B infection, which we will mention later, because it's preventable. It's something that we can manage and we can key into to prevent liver injury. Now, hepatitis. Hepatitis is inflammation of the liver. When the liver gets inflamed, okay, it's what we call hepatitis. And what happens here? Because of exposure to chemicals, okay, the liver cells begin to misfunction in different ways. And as they begin to malfunction, they release certain chemicals in the body that can affect the overall well-being. And what are those symptoms of hepatitis? Usually what you have is pain on the location where the liver is. Okay, as I mentioned earlier, that liver is on the right side. So people have pains on that right side, and the liver may become enlarged during that period. So by the time somebody has hepatitis, comes to the hospital and complains of pain on that right side, usually when we check, we find out that liver on that side is enlarged. You can now feel the liver below the ribs. Then you know that there's a problem going on. Another common liver problem is fatty liver. This is common in people who consume large amounts of fat. What happens is the excess fat, if the liver cannot handle it enough, gets deposited in the liver and can also cause liver problem. Then the third one is cirrhosis of the liver. This is scarring of the liver. Earlier I mentioned that the major problem in one of the signs of liver problem is the liver becomes enlarged, okay, and you can feel it. But in cirrhosis of the liver, what happens is liver becomes shrunken. The liver shrinks such that it becomes useless. Now, the liver cells that are carrying out the function of the liver are now replaced with scar tissue. That's what happens. Just like if you have a wound, okay, the wound, once it heals, there is usually a scar. That's what happens in liver cirrhosis. The liver cells that are doing the normal liver functions are damaged, and once they are damaged, they are now replaced with scar tissue, which are useless to the body. So the liver becomes shrunken and useless, so to say. Then the fourth one is liver cancer. Liver cancer. Now, all these four common liver problems that I mentioned, okay, can be caused by alcohol. These four problems, these are the four major. The other problems that are associated with the liver, but these are the common ones that I think is relevant for us to know. All these four problems are actually associated with excess alcohol intake and also by hepatitis B infection. If we can reduce or cut down or stop alcohol intake and also prevent hepatitis B infection, a lot of diseases that affect the liver will actually be curtailed. But oftentimes, most people that we see, especially when they come to the hospital and ask them some questions, take some history, two factors we find out. It's either they have hepatitis B infection, which they don't know, has been there for years, and they are managing it, and they don't know because oftentimes it may not come with a symptom, may not know, or they have history of chronic alcohol intake. These are the two major factors. Other factors could be there, actually herbal concoction. Those who consume herbal, who take herbal concoction indiscriminately, also could cause any of this, but it's not as common as some of these things. Then smoking is also another factor that may cause some of these liver problems. But the two identifiable factors that we readily see is alcohol and hepatitis B infection. Next slide. So we need to understand hepatitis, and I would lay emphasis on this part of the presentation. Hepatitis means inflammation of the liver. Okay, it can be caused by viruses, which is the most common cause of hepatitis. Okay, virus, alcohol, as I mentioned earlier, or some drugs, actually indiscriminate use of certain medications. Even as paracetamol, as common as it is, can actually cause hepatitis, especially when you use above the normal dosage. Okay, the most common viral types of hepatitis are A, B, C. These are the common ones we see in our environment, and they have been implicated, especially the B virus, hepatitis B virus, has been implicated in causing those four major liver diseases. Now, so hepatitis A, though is in our environment, is not as common as hepatitis B, but I will mention it briefly. Okay, it's spread through contaminated water and food. Okay, and oftentimes we can actually prevent it by normal hygiene. Make sure our food is well covered. We wash our hands, we cover our foods, and all those things. We can actually prevent hepatitis A infection. But this is the most dangerous of the form of hepatitis B. Actually, hepatitis B is more dangerous than HIV virus. It's more dangerous than HIV virus. Actually, because HIV virus now is something that most people live with. Okay, if you are diagnosed early and you are taking your drugs, you are complying with your medications, you can actually live a normal life even than those who don't have HIV infection. But for hepatitis B, okay, it's more dangerous. For example, if you have a drop of blood, okay, or let's say a drop of blood on the floor that is contaminated with hepatitis B, there's high risk of infection compared to HIV. So that shows that the effectivity of hepatitis B is more than than that of HIV. How do people contact hepatitis B? Through blood. Okay, for example, if there's blood contact between somebody who has hepatitis B with somebody who is not infected, you can actually contact the virus. Blood transfusion at times, when people get blood and it's not well screened, okay, people can actually get hepatitis B. There are two unprotected sexual intercourse, okay, one can actually contact hepatitis B. So it's also a sexually transmitted infection, just like HIV. From mother to child, for example, if a pregnant woman who has hepatitis B, okay, and is not screened, does not know, okay, he can actually transmit the infection to the baby, and the baby continues to live with hepatitis B, and which predisposes the child to having some of those complications we talked about as early as possible. And if hepatitis B is not addressed early, okay, it can cause lifelong infection and liver cancer, which is the major end effect of hepatitis B infection. Then we also have hepatitis C. Okay, also spread through blood contact. It's not as common as hepatitis B, but they can also cause liver injury as hepatitis B. Okay, it can be treated effectively. There are drugs that can be used to manage it, but the prevalence, that's number of people who come down with hepatitis C, is not as common as hepatitis B. And you find out if you run a test, okay, for example, if you go to a community and try to screen them for hepatitis, majority of them will actually come down with hepatitis B compared to hepatitis A and C. There are other forms of hepatitis too, hepatitis D, hepatitis E, but they are not common in our environment as hepatitis B. Okay, what are the symptoms of liver disease? So how do we know, or how does someone know he has a liver disease? Oftentimes, liver disease is also silent, it's quiet. People may not know, but there are some classical signs that once you see, you know there's a problem with the liver. One of them is yellowness of the eyes. Yellowness of the eyes. If you check somebody's eyes, ideally the eye should be white. That's the one part of the eye that is usually visible. It should be white. That's the ideal color. But once you see a yellow color discoloration of the eye, then it's nothing but liver disease. But it's not absolute. But in certain people, for example, those who are sicklers, okay, could also have yellowness of the eye because of increased breakdown of their blood cells. Okay, but you also need to differentiate between those who are sicklers from those who are hepatitis, who has a liver problem. So it's not all yellowness of the eyes that is a liver problem, but oftentimes, okay, when you see somebody who has yellowness of the eye, you need to think first of a liver problem. Then dark urine. Dark urine. Because the liver cannot handle because the liver is now damaged, there are some things that are produced in the body that the liver helps to manage. Okay? If the liver can no longer carry out those functions, those chemicals are passed in the urine, and the urine becomes very, very dark. Urine becomes very dark, just like we call it Coca-Cola colored urine. So by the time you see somebody passing Coca-Cola colored urine, then you may need to begin to think of a liver problem. Then the pale stools. What happens in this situation is the stool, poo-poo, becomes white. Is white. Normally the stool should be golden yellow, golden yellow color. But in a liver problem, the stool becomes white. That yellow color you find in stool is actually produced by the liver. It's the function of the liver. The liver is producing certain chemicals that is secreted into the intestine that makes the urine to be yellow, golden yellow, that color. So it shows normal liver function. So when you pass the people and say, my poo, because when you come to us, we ask you, what's the color of your poo? And you say it's yellow. Most likely there's no liver problem. But by the time you're telling me, my stool is looking like white color, then it means the liver is not functioning. There's a function of the liver that is not performing, that is making the stool to be white. Okay, then there's a problem. So it's also good by the time when you use the toilet, please let's check our stool. It could be a pointer to a liver problem. Once you notice that your stool is getting white and all those things, then please you need to take caution and see a health care practitioner. Then swelling of the abdomen. This is also very important. Okay, in swelling of the abdomen, what happens? The tummy becomes big. It's because what's making the tummy to become big? Because of it could be a result of different things. One, the liver itself has become big. If the liver has become big, it will actually reflect in the tummy. The tummy becomes bigger. Or there is water accumulating in the tummy. We call it ascites. Now, part of the function of the liver is to produce certain factors. We call it proteins. These proteins help to keep water within the blood vessels. Those proteins help to keep water within the blood vessel. That's the function of the protein. The protein is called albumin. It's produced by the liver. It helps to keep water within the blood, so that all the water we take can be flowing in our blood vessels. But when the liver becomes faulty, it no longer produces this protein. So the water that's supposed to be in the blood vessels, in the artery and the veins, begin to move out. And once they move out, you begin to look for spaces where they can stay. Okay? So part of where they can stay is in the tummy. So the tummy now becomes filled with water, because the protein that is keeping the water within the pipe, that's the blood vessels, is no longer there. So the fluid now begins to move outside, and you can accumulate in the tummy. So the tummy becomes big. It can also accumulate in the legs. That's why the legs becomes also swollen. Okay, because the protein can no longer retain water within the fluid. So fluid now begins to move to all the spaces. The face can become swollen, the legs become swollen, and the tummy becomes swollen. So those are signs of liver problem. Then fatigue, undue tiredness. The person can no longer walk within 2 poles, can no longer walk from one pole to the other. It's already tired. Or climbing of staircase, because the function of liver is reduced. Then loss of appetite, can no longer eat well. Okay, then itching, generalized body itching, also because certain chemicals that the liver helps to remove from the body is no longer, the liver can no longer do that. So the chemical is now exposed, the body is now exposed to that chemical continuously, and can actually cause itching. Now, let's talk about hepatitis B infection, because this is where I want to lay emphasis on, and as a take home for those of us who have not done screening for this virus. It's increasing now, okay, and Nigeria has the highest number of hepatitis B infection. People are actually infected virtually every day, okay? 1 in 8 adults carry the virus. So it means if you take 8 adults, at least one person will have hepatitis B infection. Many people don't know they are infected, because, as I mentioned earlier, once you're infected with this virus, it begins to multiply gradually in the system, especially if the body is unable to fight it. The virus begins to multiply within the system until it gets to a point where it now takes over the whole of the liver. By the time it takes over the whole of the liver, there's little to what can be done. So that's why it's important for us to screen ourselves. For alcohol, at least if you know you are not taking alcohol, the chance of getting a liver issue is not there. Okay, but if hepatitis B infection is there and you don't know, okay, it begins to cause damage to the liver gradually. And one thing about hepatitis B is it does not affect any other part of the body. It doesn't go to affect the brain, it doesn't affect the liver. It just goes straight to the liver and begins to cause its own damage gradually. Okay. Next slide. Okay, so earlier I mentioned about how hepatitis B can be contacted. Okay, blood contamination, sharing of sharps. Okay, when they use the same needle for different people, somebody who is infected and shares the same sharp with another person, one can get infected. Then getting vaccinated is one of the ways you can actually prevent this infection. Getting vaccinated. At least if you are vaccinated, you have a 90 to 99% chance of not having hepatitis B infection. And that reduces the risk of having some of these liver complications. The vaccination actually starts from childhood. It's part of the National Program for Immunization for Children. Hepatitis B vaccine is part of it. And that shows how important it is. So for children, we expect them to have gotten their hepatitis B vaccine. That reduces the risk of them contacting the virus as they old. For adults, because adults are excluded from the NPI, that's National Program for Immunization, there's room for us to get vaccinated. So usually what we do is we'll screen you. Once you check your blood and it's negative, we recommend you to go and get your vaccine. You do a blood test, it's negative, you go and get your vaccine. It is very, very important. It's very, very important. These vaccines are actually free if you go to any of the government hospitals. You just need 3 doses, okay, for you to get vaccinated. And subsequently, you can take your booster dose. Though it's not necessary, but usually after 5 to 10 years, some people recommend that you take booster doses. But the 3 doses actually gives you 90 to 99% prevention against hepatitis B virus infection. So it's something we need to take important, especially for those who are at high risk of contacting the virus, especially health workers. Health workers are people that actually at high risk. So they're expected to be vaccinated. I've gotten my own vaccine, complete dose. And for those of us who have not gotten, please let's ensure we are vaccinated, because you don't know who you can actually come in contact with. And also for some of us who go to barbering shops, okay, to cut our hair without our own personal clipper, you are also not at risk. You wouldn't know the person that has been affected, okay, and they will use the same clipper and one can get. So that's why it's very important for us to get vaccinated. Okay, how can we prevent? Avoid sharing razors, needles, and toothbrushes, because it can actually be transmitted to those areas. Practice safe sex. Ensure blood is screened before transfusion. This is very important, especially when you're in the hospital setting. You won't transfuse blood without proper screening, because there are instances where people have actually contacted the virus from blood transfusion. So it's very important to ensure that blood is screened before transfusion. Then how can we prevent liver damage? Okay, one way is just living an healthy lifestyle. Okay, apart from the specifics that we discussed, do your immunization and all those things, you need to also live healthy. Balanced diet with fruits and vegetables. They contain vitamins, and some of the vitamins are required by the liver to produce those chemicals, those proteins that helps to fight infection. So it's very important for us to know. Then avoid excess alcohol and unnecessary drugs. This used to be the past. That usually, what we used to preach in the past is stop smoking and reduce alcohol. But now is the absolute stop everything. Okay, because we found out that no amount of alcohol is safe for the body. Then unnecessary drugs, yes. So don't just use drugs indiscriminately. Some of these drugs are dangerous. If our distances of somebody who use certain medications, drug overdose, there are certain drugs you cannot combine together. Some of these things can actually damage the liver. So unnecessary drugs should be avoided. Oftentimes, we want to take a shortcut for our health, but it doesn't work that way. You've been stressing yourself, you're not resting, you're not taking paracetamol so that you can continue work. No, what you need is bed rest. At that point, you don't need to take any medication. You just need to rest and you'll be fine. But we don't do those things. You go to the pharmacy, you get medications to cure what should have resolved by just ordinary bed rest. Okay, then maintain a healthy weight and exercise regularly. This cuts across all our, not only for the liver, okay, blood pressure, diabetes, all those things requires us to have a healthy weight and also live healthy. Okay, a simple blood test can detect hepatitis B. It's very simple. It's just within seconds. Take just a drop of blood and run it. And if it's positive, okay, I'll talk about how to manage it. So usually what we do is once you run a test and it's negative, if you do hepatitis B screening that is negative, you go for your vaccination, which means you go and get injection to prevent you from getting the virus. But once you run a test and it comes out positive, that's not the end of life. Okay, what we now go further to do is, okay, now that you are positive, the other tests we also need to know. Because it's not everybody, the truth is not everybody that has this hepatitis B infection that needs treatment. That is the truth. Not everybody, it's not automatic. Once you have hepatitis B, you start taking medications. No. We also need to do some further tests. We need to look at the liver. We call it the liver function test. We look at the liver to see if the function of the liver is still okay. If the function of the liver is still okay, that is a good thing. It means it's just starting and it has not really affected the liver. Usually what we need to do is we do a follow-up. After we check the liver function and it's normal, we also need to look at the liver picture itself. They may tell you, okay, go and do a scan of the liver. You do a liver scan to check whether there are some damages in the liver. If the liver structure is still fine, it shows, okay, it's still an early thing. Then we also need to look at the number of that hepatitis B virus in the blood, because there's a threshold. Okay, at a certain level, this person needs to be on drug, irrespective of what all the other tests are saying. You understand? So we also look at the number of the virus in the blood. If it passes certain level, usually about 20,000, then it means that yes, this person needs to be on medication. So those are the things we need to check and we'll continue to do a follow-up. Okay. Early diagnosis saves life, just as I've mentioned. If you're able to pick the infection on time, then you can actually follow up. Okay. For those who need medications, we start them on the medication. And some may just be reassurance, follow up, healthy lifestyle, and also counsel them to live a safe life so that they don't spread to other people. Okay, actually their partners, for those who are married. Then part of what we are doing is to encourage the family and church members to get tested, okay, for this virus, because we can actually reduce the spread in our community. Just as I mentioned, hepatitis B is not a death sentence. It's not at all. A lot of people live with hepatitis B for years. What, as I mentioned, is to follow up and also reduce some of the risk factors that may also compound on the effect of hepatitis B. So you can't have hepatitis B and now start taking alcohol, which means you are compounding the whole problem. Or start taking herbal concoction and some drugs that may also affect the liver, because you're already exposed to a risk factor to a liver problem. You shouldn't add to it. So we begin to counsel you on things you need to do to further reduce the risk of liver injury. Okay, regular checkups and healthy living can control this disease, as I mentioned earlier. Just a follow-up. Okay, at usually every 6 months to 1 year, we repeat some of these tests, because the truth is, at times, over time, the body can actually develop. If the liver is strong enough, you are eating healthy, balanced diet, fruits and vegetables, and all those things. The body can be strong enough, okay, to fight the hepatitis B infection and suppress it to the point that it can no longer cause any injury. Okay, people with hepatitis B can live long and live lives with care. It means once you have it, you just need to live a more cautious lifestyle. Okay, next slide. So just a recap to know that our bodies are gifts from God. Caring for them honors Him. It's our body, but it's a gift from God. We need to take care of it, all to the glory of God. Okay, we need to encourage ourselves to live wisely and healthy. Now, because of our environment, we're exposed to a lot of form of risk factors that can actually cause a lot of injury to our body. Okay, and we need to be cautious that our life, we only live once, but we need to live a healthy lifestyle so that we can be useful both for ourselves, for the church, and for our community. Next slide. So how can we promote liver health in the church? Organize regular health talks and screenings, which is part of what we are doing today. I believe some of us have been able to check our blood pressure. We know what our value is. We know what our sugar is. Okay, those are the ways we can also help to optimize our health. Regular screening is not only about our blood sugar and blood pressure. We can also do urine analysis. If you do your urine test, it tells you a lot of things about your body. It tells you how well you are well hydrated. Because if you do a urine test, it can tell you whether you are taking enough water or not. It tells you whether you are dehydrated or not. It tells you if there's an infection somewhere. It tells you if you have a kidney problem and a lot of things from a urine test. So it's good to do those regular checkups and health check. Okay. Invite healthcare workers to educate members, which is part of what we are doing today. And for those of us who have this infection, hepatitis B, that we know, it's also good to encourage ourselves, okay, and our way to go and how to live a more productive and a healthy lifestyle. Okay, so before I go, just a basic health tips generally for us to know. As I always say, health promotion is very important. Health prevention is better, okay, and prevention is better than cure. What we are actually advocating and what healthcare or medicine is going into now is more of preventive healthcare. Prevention is better than cure. We don't want to start treating. We want to start managing complications. We want to start hitting it right from the onset, and that is drinking enough clean water daily. I've had instances where people come to me and say, doctor, I want to detox. They say they want to detoxify themselves. Okay, and they'll say, I want to flush all my system. There's nothing like flushing all our system. Say, I went to one pharmacy, they flush all my systems. There's nothing like that. You can't flush your system other than by taking water. This is the only way we can detoxify the liver, or we can flush our system. If you want your liver to be healthy, if you want your kidney to be sound, it's adequate water intake. At times we find out that our urine smells. Our urine changes color, very yellow colored urine. You don't need anything to detoxify your this thing. You just need to take water. Once you take water, enough fluid goes to the kidney. A lot of fluid goes to the liver, and any toxin in the body is easily washed away. So the only way we can detoxify our system is by taking clean water. And when I mean clean, when I say taking water, at least minimum is recommended for adults to take at least 3 liters of water in a day. That's about 6 sachets of pure water. Eat less fried and processed foods. Okay, so we also encourage reducing fried foods. You do more of air frying rather than using oil to fry. You grill, you oven. Okay, that reduces the amount of oil you take. As part of earlier, I mentioned that fatty liver is also one of the diseases that affects liver, accumulation of fats in the liver, and can also cause a lot of liver injury. And one of the ways we can also prevent that is minimizing our fat intake. Okay, so instead of using oil to fry, then you can actually use an air fryer or use a grill or oven to make our food. I know a lot of us like eating chicken. We like turkey. I also love it, but the skin of chicken, turkey is actually high in fat and cholesterol. So if I thought you're going to eat your chicken and turkey, it's advisable you remove the skin. Okay. Fruits like or vegetables like cucumber, garden egg is very good to reduce our fats in the body. Then avoid self-medication. So if for most people that indiscriminate use of medication, you just go to the pharmacy, you get medications. At times we feel our problem is malaria and typhoid. You go to the pharmacy, you get malaria drugs, you take typhoid medications, then the problem still persists. Oftentimes it's just about lifestyle. All this headache, body pain, I think it's malaria or typhoid. It's not. It's just you not taking adequate rest, taking adequate water intake. Sleep well and manage stress. Yes, we're in a fast-paced economy. Everybody's hustling. We are trying to make ends meet, and stress is telling a lot of people. When you are stressed, there is increased production of cortisol, adrenaline, and some of those chemicals in the body. They can actually put a lot of stress on our system, the liver, the blood vessels, and all those things. All those things will make our blood pressure to go up. All we just need to do is to be more relaxed, adequate sleep, adequate bed rest, and we'll be fine. Do not smoke, okay, because smoking is actually a major factor for most diseases that we have in our environment. And also alcohol, they are brothers and sisters. There's no disease in the body that is not associated with smoking and alcohol. Is it stroke? Is it hypertension? Is it heart disease, kidney disease, liver disease? Any form of disease in the body that you can think of. The major culprits. Is it cancer? Smoking and alcohol are part of it. Then exercise regularly for us to be able to maintain our weight. At least 30 minutes of brisk walk every day. It's helpful for us. So by and large, these are just basic health lifestyle tips that I think would help us to live a normal life. And by the time we do this, a lot of diseases, a lot of unnecessary drugs that we use, a lot of unnecessary hospital visits. Because at times some of these hospital visits may not even be necessary if we have taken care of ourselves. God desires that we prosper and be in good health. As in 3 John chapter 1 verse 2. Wisdom is caring for the body, brings us life and peace. So we care for our body. Long life is there for us. So call to action as a summary is to get tested for hepatitis B this month. As part of our awareness for liver, I think 2 months ago was hepatitis B, or World Hepatitis B Day also. Please try as much as possible. If you have not been tested, to test for yourself for hepatitis B. You will do yourself a lot of good. And if not vaccinated, talk to a healthcare provider. They can assist you to see how you can get vaccinated. And I think in most of the government hospitals, not most, I think government hospital it's actually free or at a little token. Okay, encourage others to protect themselves and their family. So if somebody that is living with hepatitis B, Then it's important to also be careful so that you don't spread the disease to other family members, because the prevalence, the rate at which people are actually contacting this virus is on the high side. So thank you. This is where I will end our health talk. If there are questions, we can. Thank you.
Okay. If you have questions you want to ask, probably if you are in need of a sheet of paper, you can ask the ushers, they will give you. But if you have a paper, you can write by yourself. Just get it across so that we can quickly attend to them. And if you find it difficult to write, you want to ask orally, you can go ahead and do that. Just raise up your hand so that those questions can be easily addressed. Okay, number one. Any other person with a question? Okay.
Praise the Lord. My question is just about this hepatitis B transmission. Is it true that through sweat one can contact it? Maybe somebody is sweating and another person touches his or her clothes or stuffs. Can it be transmitted through sweat?
No, hepatitis B is a blood-borne infection. Usually, you can only contact it through sweat, quote and unquote, if there is a break in the skin and is contaminated with blood products. You understand? So if it's just sweat to sweat, no. There must be a breakage. The skin must be exposed and there's blood in the sweat. You understand? But if it's just ordinary sweat, no. But it must be contaminated with blood products. You understand? That's what one can actually, it's a blood-borne infection. Blood. So if there is sweat, if there is sweating and is contaminated with blood, definitely, and the other partner, the other person who does not have infection has a crack in the skin, then you can actually contact the virus. But if you have an unbroken skin and sweat comes in touch with it, no, you can't contact hepatitis B through that way.
Thank you very much, sir. Please, I just want to get clarification on the vaccine. What is the consistency of the vaccines in respect to how consistency, if it is months or is made mention of the time frame we will be using to take the vaccine? How consistency should we do that? Thank you.
Okay, so for hepatitis B vaccine for adults, it's 3 doses. Usually the first one is when you come in, the first dose, let's say you are getting your first dose today, that's 0. Then a month after, you get the second dose. Then 6 months after, you get the third dose. Those are the 3 doses. So just 3 doses, 0, 1, and 6 months. 0, that's the first time you get the first vaccine. A month later, you get the second dose. Then 6 months later, you get the third dose. Those are the 3 doses. Then the question I have here is, are there ways of preventing mother-to-child transmission of hepatitis B? Yes, there are ways to prevent mother-to-child transmission. So if you have an hepatitis B positive mother, okay, usually we follow them up. And as I mentioned, it's not everybody that has the virus that is placed on medication. Usually we follow them up. If a mother meets the criteria, if a pregnant woman, hepatitis B meets the criteria, just like a normal adult person to meet the criteria for for medication would commence the adult, the mother, on medication. Okay, but if she does not meet the criteria to commence treatment, usually we leave them. But what happens is, at the point of delivery, that is where most transmission occurs. It's not even when they are carrying the pregnancy. It's at the point of delivery. So usually what we do is, as much as possible, there are some things we need to do. You don't allow your water to stay long, blah blah blah, and all those things. But once the mother delivers, what we do is immediately, within 48 to 72 hours, the baby gets vaccinated. Then also gets what we call hepatitis B immunoglobulin almost immediately. So the child must get vaccine and also get the immunoglobulin. The vaccine is to help the body develop, is to help the baby develop its own antibody to fight the virus in case it's in the blood. While the immunoglobulin is a preformed antibody that helps to neutralize any form of hepatitis B infection that is in the baby's blood. So that's what is done. So at the time of delivery, once the baby is delivered, the baby gets the vaccine immediately and also gets what we call hepatitis B immunoglobulin that helps to neutralize if there's any hepatitis B infection in this baby's blood. So that's what we do to prevent mother-to-child transmission.
Praise the Lord. Thank you for this contribution. About that vaccine that the baby will take after delivery, please, if you have somebody that doesn't register in government hospital, it's very, very important. Because a lot of people that deliver in healthcare centers, some of them are not checked for hepatitis B and they will not be prepared. And this vaccine is very costly. So please, it's very, very important that we know our status. And please, if there is anybody, people that are above 20 years, please, if you are yet to know your hepatitis B status, please, you can register your name with Nurse Tokwe. Nurse Tokwe, please raise up your hand. Maybe we're going to make arrangements for how we will be checked and how we can start being vaccinated. If you are above 20 years, why I say above 20 years is 20 years ago that they started giving babies as immunization. Before 20 years ago, it was not in the normal vaccine that baby takes. But 20 years below, babies have been given when you are taking immunization in the government hospitals. So please, let's carry this message out that anybody that is above 20 years should go and know their status. Please, it is very, very important. And if somebody is hepatitis B positive, please don't joke with giving the baby that immunization within 72 hours. We have seen, even in this church sometimes ago, somebody that delivered in a place where they don't even know about that vaccine. So God will help us. Thank you, Doctor.
Deacon has another question.
Praise the Lord. Sorry, I just have one other question. My question is, what's the effect of cold water? I mean cold, very cold, like ice water on the liver, or the hot water on the other flip side. Maybe you want to take a hot tea. Does it have effect on liver? Or you are taking very cold water. Does it have effect on the liver? Thank you.
All right, thank you very much. So it will surprise us to say that there's no effect because the water you are taking does not get to the liver. If you look at, it only goes from your throat to your stomach. That's all. It doesn't get to the liver. Liver is far away from the liver. I mean, the liver is far away from where the stomach is. So whatever you take does not get to the liver. And by the time it gets to the stomach absorbs the water. You're only going to feel the temperature within your stomach. It does not get to the liver at all. So it has no effect at all on the liver. what you only feel is the temperature as it goes through your throat down to the stomach. And if the temperature is so high, it can cause burns. You just burn the throat and cause another form of another wahala we begin to manage. You understand? So it does not have any effect at all to the liver. Extremes of temperature is not good for the body. It can actually cause damage to the cells within the system. So it has no effect on the liver. And at times some people say I'm taking hot water to Yoruba will joy or something. There's nothing like that. It doesn't get to where we feel is getting to. It just goes through your throat down to your stomach, and the body is absorbed by the body. Then the others are passed in the urine. I don't know. Okay, so all right, no other questions. Thank you all for listening. God bless you.